Let's look at the muscles involved in breathing. These muscles can be classified as muscles of inhalation or muscles of exhalation, although it's a bit more complicated than that. Typically, breathing we can divide into normal quiet breathing and forced or labored breathing. Let's first look at normal quiet breathing. This is probably what you're doing right now. If you're sitting down, resting, watching this video, you're quietly or your breathing is said to be normal. If I were to ask you to stand up and start doing jumping jacks, we would call that forced breathing. Let's first look at quiet breathing. When you breathe in, or the process of inhalation, that requires the diaphragm and external intercostals to contract. Okay? Contraction of the diaphragm and contraction of the external intercostals expands the thoracic cavity. The diaphragm acts to kind of lower the bottom part of the thoracic cavity. So when the diaphragm contracts, it flattens, and that enlarges the chest. The external intercostals, located in between the ribs, move those ribs up and out. So together, when they contract during quiet inhalation, the thoracic cavity expands, and therefore the lungs expand. When your lungs expand, the pressure inside the lungs drops. This low pressure allows air to enter the lungs. When you exhale quietly, these muscles relax. Therefore, quiet exhalation is known as a passive process because the muscles are relaxing. So again, let me summarize. During normal quiet breathing, the diaphragm and external intercostals contract. Contraction of these muscles expands the thoracic cavity. When the thoracic cavity expands, the lungs expand. Pressure drops inside the lungs, and air moves in to the lungs. When you exhale, these muscles relax. There is a normal elasticity to the chest wall, which squeezes inward. The pressure in the lungs goes up, and you exhale. Now, is there a difference between the diaphragm and external intercostals? The answer is yes. Typically, we say the diaphragm is the most important respiratory muscle. During quiet breathing, most suggest that about 75% of the air that enters the lungs is due to the diaphragm contracting. The other 25% is due to the external intercostals. Okay, so now you are breathing heavily or forced breathing. During inhalation, you still use your diaphragm and external intercostals. They will still contract, but we have an additional set of muscles that will also contract. The sternocleidomastoid will lift up or elevate the clavicle as well as your sternum. This expands the thoracic cavity as well. Then there are some other muscles in your neck called scalenes. Scalenes are attached to ribs 1 and 2, and they will pull up on ribs 1 and 2. So those muscles are said to be accessory respiratory muscles of inhalation, forced inhalation. When you exhale forcefully, all these muscles will relax. Sternocleidomastoid, scalenes, external intercostals, and diaphragm. And to force more air out, to compress the chest in more, we use accessory respiratory muscles. These muscles will contract during forced exhalation. They are your internal intercostals, your abdominal muscles, as well as a muscle known as the pectoralis minor, which is not shown on this drawing. But those muscles collectively will squeeze your chest in, push your diaphragm up even more, make that chest size even smaller in order to exhale even more air during forced exhalation. So what I recommend doing is think about breathing in 4 stages. There's quiet inhalation, quiet exhalation. There's forced inhalation and forced exhalation. The job of these muscles, again, is to change the size of the thoracic cavity. If we look at this figure, it gets a little more complicated because now we are looking at pressures. Air moves from an area of high pressure to an area of low pressure. Therefore, the process of breathing involves changing the pressure inside the lungs relative to the atmospheric pressure. So we're going to walk through this figure. I'm going to actually read these sections, and I want you to think about it. We've got 3 stages here. The first stage is kind of a pause in between exhalation and inhalation. During phase 1 here, no air is moving. Notice that at each of these 3 stages, atmospheric pressure is all 760. That's the pressure in our atmosphere at sea level. Now, as we elevate, when we go to higher altitudes, that pressure is going to change. But since we live in Florida, we are at sea level, 760. So that number is not going to change. We have 2 other places to look at pressure. Pressure in the lungs, we call alveolar pressure. Pressure in between the membranes that surround your lungs, called intrapleural pressure. Let's look at alveolar pressure. At this stage, pressure in the atmosphere is 760. Pressure in your lungs, or alveoli, is 760. There's no difference in those 2 pressures, so air will not go in, nor will it go out of the lungs. The pressure in the intrapleural space must always remain below the pressure in your lungs. So we call this a negative pressure. So if you compare these 2 pressures, the intrapleural pressure is always below. What that does is helps to prevent your lungs from collapsing. Okay, if there was a high pressure in the intrapleural space, it would push in on the lungs and the lungs would collapse. So you'll notice at every stage that pressure is always below the pressure in the lungs. Okay, let's transition from step 1. We're at rest. The diaphragm is relaxed. Alveolar pressure is equal to atmospheric pressure, and there's no airflow. We go to stage 2, inhalation. During inhalation, the diaphragm contracts and the external intercostals contract. We know that. The chest cavity expands. The alveolar pressure drops below atmospheric. This follows what we call one of our gas laws. This gas law states, and this is known as Boyle's law, that the size of a container is inversely related to the pressure in that container. So, as the chest cavity expands and gets bigger, the pressure in the lungs is going to drop. As that pressure drops, air now will move from where there's a high pressure atmosphere to where there's a low pressure alveoli. Air goes from high to low. So air flows into the lungs in response to the pressure gradient, and the lung volume expands. If we were forcefully breathing, we would include the scalenes and sternocleidomastoids to expand the chest even more and creating a greater drop in alveolar pressure so we can keep filling those lungs. So that's the process during inhalation. Notice the intrapleural pressure also must drop a bit because we got to keep that pressure below alveolar pressure. So we just inhaled. Now we go to stage 3, exhalation. During exhalation, the diaphragm relaxes, external intercostals relax, the chest and lungs recoil, so the lungs are going to recoil inward, the chest cavity contracts, and the alveolar pressure increases above atmospheric pressure. So now the inverse occurs. The chest gets smaller, therefore the lungs get smaller. When a container gets smaller, the pressure goes up. As long as we keep that alveolar pressure above atmospheric pressure, air flows out of the lungs in response to this pressure gradient, and the lung volume decreases. If we were forcefully breathing, we would include our internal intercostals and our abdominal muscles, reduce the size of the chest even more, and create a greater increase in alveolar pressure so we can get more air out of the lungs. Notice as alveolar pressure went up, so did intrapleural pressure. So, in summary, lungs get larger, pressure goes down, air goes in. Lungs get smaller, pressure goes up, air moves out. We need to be able to understand alveolar pressure versus intrapleural pressure and look at those relative to atmospheric pressure, which is the easy one because it's not going to change, 760. In the next video, we're going to look at different lung volumes, which is a very important clinical idea to understand because these volumes are important when we assess someone's respiratory system.